According to a recent report by the National Alliance of Mental Illness, minorities in the US are more likely than their counterparts to experience mental health issues. Black adults, in particular, have experienced persistent symptoms more than their counterparts, including emotional distress, sadness, hopelessness, feeling like everything is an effort, and thoughts of suicide. Minorities living below the poverty line are more than twice as likely to report serious psychological distress than those with more financial security. Joining us today is Dr. Kres Snyder, who is the president of Minds Empowered Counseling Services. We are still in this pandemic in 2022. Mental health has not changed for many. In your profession, what advice would you give to people who are still struggling with mental health issues?
A few things. Probably to be consistent with sleep for sure. Really try to have a routine related to sleep, related to diet and exercise, like trying to be as consistent as possible to your body and like having a routine really helps with stress and anxiety. Something simple as walking, deep breathing, text and phone calls with loved ones, like all of the crazy enough, the small things like really matter.
What are some of the negative psychological effects that you feel quarantine has impacted our mindset?
Oh goodness, confusion, anger, depression, PTSD is probably one of the biggest. We are seeing a very high disproportionate amount of people of color, low SES, people experiencing much higher severity of symptoms, suicidal ideation, emotional instability. It is not good right now, kind of what's happening, especially when we start really digging in and looking at different communities and economic groups and social groups and class groups. It gets really sad.
Yeah, we were actually reading a study that said that minorities are impacted by COVID-19 way more than their counterparts. You did mention some of the factors why, but can we dig a little deeper into that?
Yeah, I mean, I think access to resources, I mean, is just one big one. It's probably the biggest one is just access. I mean, also not just access, but we also have higher rates of people who need to work and are probably can't work because of the quarantine. And so financial strain becomes a major issue. And so it, it is just kind of systemically, it's just no way we then are attacking mental health last because we're placing like food, water, shelter kind of at the top of the list and trying to just figure it out. And it's like, I have no time to think about how I feel because I'm worrying if I'm going to eat.
And with minorities, why do you feel there's such a stigma about mental health? As a community, why are we so embarrassed and so ashamed to admit that we're struggling with mental health?
Yeah, I mean, so I first want to say I do think it's slightly getting better. I do think we are more. I know it because I watch how many Black people we serve. So it's a slight change where people are recognizing we need support. It's time to start screaming, "Help me!" But I also think it's just cultural and generational. And you take things to the church and you keep things at home, and we don't talk about our business outside the house, which means you don't talk about nothing happening about you outside the house either. So I think it's just we have to break a lot of generational curses.
Well, thank you so much for your time. I know that you
Hey,
are stuck in traffic, so drive safely.